So doc, y'all make 2 or 3 incisions?
Usually 2 incisions when you're doing this.
All right. This is almost like I'm working backwards and upside down.
It's like a video game for real.
Yeah, so whoever cartilage this is stuck in their knee right now because I blew that. All right, hold on, let me see if I get another one.
That's why we do refs, man. Free throws, baby.
Man, like I said earlier, man, I got a newfound respect now because, let me see if I twist that way.
Some of y'all came late. You might have seen me on Instagram working on doing some arthroscopic practice, what I call free throws. Using the arthroscope to pretend or practice like I'm moving pegs back and forth, just getting ready for surgery. I got my man Billy McMullen, retired NFL player, showing us how it's done. Anybody come through here, we'll let y'all get on the sticks, see what y'all can do.
I'm gonna tell you guys right now, this is a lot harder than what it looks. So I have a newfound respect. Now I had to get a scope, and I think I was down for like an hour, probably less than that, 30 minutes. And I was able to get back and play within 2 weeks, if that, a week. I was back on the field. All right, we got to stop picking it up wrong.
It's that minimally invasive, man. It lets you recover faster. There it is.
That is wild, dude.
Just get the edge of that right there.
You know what this remind me of? You know those little toys that...
Like Operation?
Yeah, like no. Well, a little bit like Operation, but more like the toys that they got the pretty cool gifts in there, but you can never grab them.
Oh, bro, it's impossible. Like they fit like the carnival. Got them.
All right, now twist it. So you got to work backwards. Let me see. If I pull it out a little bit, if I go this way.
There you go.
I'm gonna get one on there, man.
I know it.
All right, hold on.
Yeah, baby.
Get in
it. That's it.
Get on there.
That's it.
Now just push it.
Just push it in, man.
I'm gonna see if I can rotate.
We in there. We in there.
Yo, there we go.
Yes, sir.
Surgery is over.
A successful surgery. Back on the field.
Right. Let's see if we can get another one. Hold on. All right, so you said rotate this right here. This is for the light.
There you go. Yep.
But if I rotate the whole thing, that's more like it's like you said, like a submarine. So
that's right.
If it's pointing up, that means I'm seeing down.
Well, yeah. If this is pointing up, you're seeing down 30 degrees, just like
30 degrees.
That's
okay.
right. That's right.
I gotta find my bearings again. Another person watching right now, like, what is going on? You try it.
come on the show. We'll get you on too. You can show us what you got.
All right, maybe if I back up there.
There it is.
There we go.
Sometimes you just gotta, same thing in surgery. Sometimes you just gotta reorient and get back to a place where you know what's going on.
But you guys are like standing up. How long does this take? Like, it's an hour, or it depends on
Yeah, it depends on what you're doing, man. So if you're doing like an ACL surgery, it might be like an hour and a half.
That's crazy. I'm really lost now.
Oh, there you go. Try dropping your hand.
Drop.
Or raise up like this, right?
Hold on, wait. Sound like I'm really lost. I don't even know where this thing is at right now. That's crazy. Don't put me in surgery.
That's what free throws are for. Man. There it is.
All right, so it's right there. You know what? I wonder, man. Like I'm in the process of learning guitar.
Yeah.
You got to use 2 hands to make a sound.
Yeah.
I'm wondering if it's something like this, because if it is, we got to get a lot of free throws. So I'm going this way. I should be going this way.
There we go. Boom, boom, boom.
Right.
That skill you just showed, that's called triangulation, and that's the key to getting good at arthroscopic surgery. What you're doing is you're inferring based on where your camera is, the angle you got to shoot at to get your tool where the camera is so you can see.
Triangulation.
Triangulation, yes, sir.
So I'm over here. This is crazy. I can see how somebody can get really frustrated over this, man. Because, I mean, especially if you just start.
When you're going through the learning process, man, that's why training for surgery is so long.
How long does it take?
We know it's 5 years of residency. That's after you've done college and med school. It's 5 years of residency. And some of us do an extra year in a fellowship for sports medicine or whatever your interest might be it hand surgery, joint replacement.
All right, so I'm totally lost now. All right, do me a favor. Set me back straight.
Let me set you back.
Yeah, because I'm like lost.
So always go back to center, to where you're looking at. All right, there you go.
Okay.
Stay right back in center. So a lot of times it's easiest to kind of make little small movements to get you where you want to be.
So okay, got you.
To get me where I want to be, and go attack it.
That. Small movements.
You go light work.
Let's see. Okay, got a peg. Small movements.
The camera makes everything look so much bigger. And some of y'all may not seen it through the video. These are tiny little instruments with a big camera, so you gotta kind of translate in your mind what's big and, you know, kind of the difference in the size, the scale.
Okay, I can rotate the camera like that, but come back to center like you did. Watch where it's center. Pull it back.
That was a nice reset. That was good.
So this up like that. Boom, got one.
Got him.
All right. All right, pull back there.
You can get close on that peg with your camera if you want.
So I got little pieces of tissue hanging in somebody's body right now. Lost. Dang, I don't know how you gonna get that back, dog. I don't know how dog gonna get that back.
It's too far gone.
Yeah, like, dude. Yo, you know what's crazy? I mean, whoever watching, my back is tight now. My arms are like shaking a little bit. So this is a little bit of to me, it takes a little bit of athletic ability, man.
This is some work, man. They don't tell you all that.
So you say you doing this every day, like in terms of like practicing, getting shots up every day, at least once a day?
Yeah, bro. Like I said, it's free throws. So I'm never gonna go into, you know, the game situation. Let's call that surgery, the real deal. Have them come in cold. I'll be warmed up before I work on any real person's body. So
you do this like an hour before, or?
Yeah, in the morning or sometimes the evening. Kind of depends on what the life schedule allows for.
Man, I'm losing all of them to this.
Try to open up your jaw. Yeah. Yeah.
Got it.
Got him.
All right. Pull back.
That's exactly right. You just follow your camera over.
Other way.
This is it.
Can I go 2 for 2?
Oh, baby.
Sorry, sir. Hey, I had it, but he woke up from the anesthesia.
He woke up
He
too
woke
soon.
up too soon. Don't blame the doc.
We did everything we could, man. We tried.
So I feel like it's just, I'm either, let me see if I can rotate this camera back
There you
a little
go.
bit.
And this is something that happens in surgery a lot too. Sometimes we get focused in on the area. We have to step back and take perspective or reorient
So
ourselves.
who's the dream team while you're in there?
Who's the dream team?
Like, I mean, like in terms of like who's in the room while you're working?
Oh yeah, so I have a surgical assistant, a physician's associate. Some people call them physician's assistants. Her name's Sherma. She's the absolute star. So she's my right hand when we're working. And you have a surgical tech who's kind of the one handing me the instruments, the sterile instruments.
Okay.
You have a circulator nurse who's actually not in the surgery. He or she's actually outside, kind of moving around, doing things that we can't do because our hands are sterile, so we can't be touching things. So if I need something from like outside the room, or someone needs to go like do something simple like turn the lights off or on or something, that person can do that as a circulator nurse. They're helping administer drugs. And then you have anesthesia, who's kind of keeping the patient asleep, like you alluded to.
So it's 5 of you guys.
At least. Yeah,
At least
so it's a
5.
team effort. It's a team effort.
I gotta take a break.
Yeah, you got it, man. You got
That's
it.
real.
You got it.
I at least got one.
Man, that was Billy McMullen, retired NFL player, on the stick showing us how it's done, man. It went well. Listen, man, this takes years and years of practice. It don't happen overnight. So now y'all have gotten a little taste of it, man. So you want to be next? Hop on board, man. We'll see you on the podcast.
So what you guys don't know, I'm gonna go another round when the camera's off. I don't like losing.
There you go. There you go. Reps is reps, baby. Yo, it's crazy because all the joints in your body are kind of locked down in a sense. So when we're doing arthroscopy, we have to actually fill that joint up with fluid. So people ask, why is my knee swollen after surgery? Why is my shoulder swollen up? It's because we had to literally fill it with fluid,
right.
so we could actually move around and get a clear picture. So I know anytime I do an arthroscopic surgery, I take pictures and literally show the patient when they come back for their follow-up. And the most common thing I hear them say is, it looks like outer space. I'm looking at an alien planet or something, because everything's so zoomed in.
Right.
When you see the cartilage, you see the ligaments in detail like that.
Is that the reason why you got specialties? So you got, some guys specialize in your knee and ankle, and then others have the shoulder or the neck or something like that, because it's different views, and it's just like you're not familiarized with what's going on in the body in that certain area. Is that the reason why you guys sort of focus on one or two areas?
Yeah, I would say it's impossible to be good at everything.
Okay.
And so the anatomy, or rather where everything is in every joint, is so detailed.
Right.
No one is going to be able to master every aspect of every single joint. So really, the way that medicine has progressed, and this is true across specialties, people are going to do what makes them what they're the most comfortable with.
Gotcha.
And subspecialize in that, become the best at that. And that's what you want as a patient. You don't want someone who kind of dabbles in the surgery to do your surgery. You want to be with somebody who this is their thing.
This is their thing.
This is what they do. Right.
Well, that's basically life, though. You want somebody, if you hiring someone or you partner with someone, you want somebody who has at least 1,000, 10,000 hours in something that you're good at.
That's right.
You don't want the guy to say, I slope it. What's the kind of commercial go?
Holiday Inn.
I could do your knee surgery. You definitely won't want that, man.
I saw us on YouTube last night. We're good.
Yeah, right. Yeah, exactly right. I studied this. Yeah, I did this one time. So right now, guys, you definitely don't want me doing your knee. But this is fascinating. I have a newfound respect. I mean, coming from playing in the NFL, playing college football, I had several buddies of mine that have had surgeries, and all we get is their perspective. We very rarely ever really talk to the doctor and then see the reps that goes within getting things right and making sure that the surgery comes out pristine. So this is amazing. I mean, like I said, I had my knee scoped, and I bounced back pretty fast, so I'm guessing the doctor got his reps in.
Oh yeah, he's probably doing free throws. Yeah, it must have been. Yeah, I tell people it's surgery is a physical thing, right? And so I do kind of relate it to sports in a way, right? There's a timeline under which you can do it and be the best at it, right? There's a time after which maybe your body physically can't handle it. And how well you can do that kind of depends on how you take care of you. Right. So for me, that's why working out is important. That's why doing free throws is important. For me, meditation is important, right? So that I'm coming in fresh, able to perform the surgery. Because it really is, I tell you, it's like game time when we walk into surgery.
You said it before.
It's the same way. So going with that same energy, that same attitude towards it, and that's what's best for the patient. We treat this like this is the thing that we're doing, and this is all I'm doing right now.
That's great to hear, because I know we had that conversation before about game time. I was wondering, like, you mentioned meditation, you mentioned mental preparation, being physical. Like, what's a normal week look like for you to prep towards those? Like, I woke up at 8, I meditated, I got an hour of practice, and I was just practicing putting the peg on the bottom ones. What does that look like? Because I'm curious to see.
Yeah, for me it varies by week.
Okay.
Because there's some days I have surgery, some days I have clinic where I'm seeing patients. Still, clinics when I see patients in the clinic, you go to a doctor's office and you come and tell them what's going on. So that's either seeing new people who might have injuries, or I'm seeing people who have had surgery, making sure they're doing well. Right. And so on clinic days, the day maybe starts a little bit later. Surgery days I'm up usually 4:35, something like that. Right. Wake up, get some reps in on the free throws, meditate. I actually like to go work out before surgery. All right, to kind of get the mind going, everything's pumping. Right. So go out, go work out, go into surgery, and then kind of meet the patient. I would have met the patient several times before the day of surgery, right? But the day of is a great time to answer any last minute questions, talk to their family, make sure everybody's comfortable with the plan, and then it's game time. It's game time. Then we go in.
That's crazy, man. That's amazing, actually. That's amazing.
Yeah, I mean, it's crazy what we do, man. But I found that it's important to give it the proper respects that it deserves. This is another human being's life you're taking care of. Right. And so it needs every respect that I would give to, say, go into the hoop or something, right? It needs that same level of respect and, if not more, preparation.
I didn't realize until I did this how physical it is. And while I was doing it, like I said, I mean, I may sound like an old man right now, but my back started getting tight because I was sitting up. My arms starting to shake a little bit. And the first thought I thought about is y'all standing up for an hour, hour and a half, doing what I did.
Right.
So proper shoes, got out the proper shoes, got out the proper clothes. Yeah, of course you got issue clothes, but all of that matters, right?
Yeah.
Because you know you want to be focused on what you focus on. You don't want to be worrying about what. You know, the shoe is a little tight on me right now.
That's right.
You know what I mean?
We don't need distractions.
I just never dawned on me. So I would say if you guys can try this, I think you'll have a newfound respect about, you know, for what Dr. O does and other doctors in this field.
Yeah, and I mean, those of y'all playing video games now, the same skill set translates, man. This next generation of surgeons is gonna be crazy. It's gonna be crazy because they grew up playing video games, man.
That's a good point.
A lot of these skill sets are gonna translate. So we can't wait to see what y'all do with the next generation of medical care. It's gonna be crazy. It's gonna be crazy. There's a lot of overlapping skills when it comes to surgery. So most people who do sports medicine, most surgeons, they specialize in knee, shoulder, and sometimes the hip. Those are the most common things we see injured in sports. So when someone says I'm an orthopedic sports medicine surgeon, they're probably saying I'm a specialist in arthroscopic surgery of the knee, shoulder, and for some of us for the hip.
Okay.
That's the most common. Now it can vary. Some people have some specialty in the elbow too, the ankle, but I would say knee and shoulder are the most common. So a lot of those skills do kind of translate in between. But again, you'll have people who, you know, have my same training who might self-specialize a little bit more here or there. For me, I'm a little bit more hip and knee, and I do shoulder a lot, but not quite as much as the other two.
Okay.
You get some guys who are, you know, all shoulder almost, and they're a sports medicine physician just like me. So it has a lot to do with what your community needs. So
gotcha.
Yeah. So when I touched down where I'm at here in Richmond, you know, there was a big need for skilled hip arthroscopy, and I had that skill set, and so therefore the practices kind of went in that direction.
Gotcha.
Right. The ACLs. I mean, a lot of people, you know, ACLs are a very common injury. A lot of doctors feel comfortable with that, and so to that. And that nature is kind of diluted, right? So you could go to different places and get an ACL. But not a lot of people in this area are doing hip arthroscopy, so that's why my practice in hip went up so fast.
Gotcha.
Because there was a real need in the community.
Okay.
But you're absolutely right, man. The skill sets, they all translate in between them, for sure.
So you like your schedule, like I brought my daughter to see you maybe 3 weeks ago, maybe 3 weeks now. And you were ripping and going. You were ripping, taking notes, talking to your team. But one thing I do appreciate that you came in and you took your time to understand what you let her speak her mind and what she thought was going on. You sat with us and gave us, you know, your undivided. You know, I've been in some places it's been very transparent, where it was a rip and roll, it was a rip and run. I mean, we couldn't even get 2 words out.
Oh, for real.
You signed it, you know, hey, this is what's going on. We out of here. You know, like hold on, we didn't even give you a chance to let us share what's going on in our body.
Oh yeah.
You may know, but let us share.
Right.
But you took time on that, and but that takes being present. That takes, like you said, having a being very focused and not distracted. Now, as you move through, you got a couple days that you're seeing patients and a couple days that you're doing surgery. Like, what's one of the things that you do when you notice that, man, I'm a little distracted today? Yeah. Like, it's been a lot going on. I had these files I had to file. I had to maybe reprimand a team member or whatever, you know, I gotta do some other things, right?
It's real life.
Life is life, right?
That's right.
Like but now it's game time.
Yeah.
Like, how do you turn that switch, but how do you more so get rid of those like distractions? Like,
just clear it out.
Yeah, how you clear the distractions out.
Yeah. That's where the meditation skill set, I think, became big for me. And I would say I started doing it consistently at the end of my residency.
Oh, nice. Okay.
Right? I've done it some before that, but really I'd say like the last year I really got into it, like every day.
Nice.
And so the thing for me is mindfulness meditation is what I practice.
Okay.
And so the idea is you're basically just bringing yourself and clearing everything out and focusing on the moment. All right, so one of the techniques is to focus on, for instance, your breathing. So breathing is something we all take for granted, right? But it's one of these things where you can really make it in something you really focus on. Right? So you're just following each breath in and out, in and out. And with time, if you practice that, you'll learn how to just almost like silence everything else around you, right? And so, you know, starting the day off with that is important, but using that skill set throughout the day, right? When I say, hey, look, man, hey, look, what I just saw was crazy. What just happened was wild.
Right.
We need to reset, so I'm ready to be present for the next patient. Right. The other thing, though, is efficiency outside of everything else, right? So with my team, we try to emphasize making everything else efficient that's administrative, so that when it's actually time to see the patient, we're not sitting here thinking about paperwork and stuff.
Got
you.
you.
Know what I'm saying?
Got you.
So we got to make it so that we're super efficient with all the little details that are not necessarily related to your care. So when I walk in the room, right, all that's handled.
Right.
So now we're just talking. Now we're just talking. So you can, because ultimately, yeah, maybe I know the answer, right? But really, you know the answer.
Right.
I'm a consultant, and this is your thing.
Great.
So I gotta hear your story. Like maybe I know you have an ACL tear, but what I don't know is what does that mean to you?
Right.
Right? What do you do? Is this a scholarship situation? Is this a rec situation? Is this a pro situation? Is this your contract?
Right.
So I gotta hear that part before I can make any kind of assessment of what the plan is, even if I quote unquote know the answer.
That's a good point, bro.
And that's never gonna happen if I'm not present.
Right. That's a great point. Good point.
To a young Dr. O coming up through medical school, residency, pick a place. Where's somewhere where you could have put more emphasis on your training, either your psyche, your physical training, hit the books more. Like, what would you tell a young aspiring surgeon? Like, don't forget this piece because I might not have remembered it as much, and that would have helped me get to A, B, and C quicker.
That's a great question. Your questions are being recorded though, right?
Yeah.
Oh, okay, perfect. I love it. I don't think I'm just talking to them.
Right.
Bill, so I mean, well, I think with medical school and everything, with residency, the academic portion of things is really very much cooked in. You're not going to progress very far if you're not studying up, staying with the books. So that part, I'm not saying it's taken for granted, but it's just not going to happen for you. Like those people get weeded out quickly. So that part, I wouldn't say was necessarily a problem. I think more so the keeping up with physical health. I would say, especially with residency. So y'all watch Grey's Anatomy and that kind of thing. When people talk about, I was up all night and, didn't sleep and slept in the hospital, that's residency.
That's real.
That's what happens.
That's real.
Yeah, I mean, there's more rules to it now.
Right.
So it can't be like it used to be in the day, but it's still taxing. So it's easy to get into a habit of saying just eating whatever's out there just to get through, or, you get used to not sleeping. So you go home like, man, I'm not going to work out, man. I need to lie down. I earned this, I'm gonna lie down, just take it easy. That stuff accumulates.
Right.
It accumulates quickly, and you'll look back. We wear scrubs in surgery, right? Someone gave me some great advice beginning of residency. He was like, "You don't know how much weight you're gaining when you're wearing scrubs,
Because it
kind of hides it."
Right.
And I was like, "What's this guy talking about? Whatever, man."
Right.
I was coming out of med school. I was like, "Okay, whatever." About 4 years later, I was like, "Wait a minute." I was like, wait. I was like, who's that?
Right.
Who's that?
Right.
So it's like, you got to make time for that. And that's why I had to get better at that. I had to get better at making time for that aspect of things in life, because life doesn't stop.
No, it doesn't.
And that's true for any profession. A lot of professions have a lot of training, financial advising, whatever have you, right? And you have to make time for your life, because your life doesn't stop because you're in the midst of seeking out that goal.
Somebody said, and I may misquote them, but they basically were saying, like, whatever you choose to do in life, it becomes part of your life. It's not divided. Like, I don't have my goal over here and then I have my life over here.
That's right.
It don't work like that. I've experienced that before, where I had a goal and my life is over here. It doesn't work. What your goal is, or what your pursuit is, or your practice is part of your entire life. Now, how do we make these things work together where you can have, a level of mental health, a level of physical health,
Right.
and a level of impact all together? Right. And I think that's amazing that, like I said, this has shed a big light on how I viewed medical practice today, just in this 10-minute drill that I've just done. And y'all may have saw this too, when Usher played the Super Bowl. They asked one of his but I think it was his singing coach or his dancing coach. Maybe I think it was his vocal coach. And she gave him a term. She called him an athlete singer or something like that. And transition over here, I'm like, that's basically what y'all are. You said, you're an athlete.
Yeah.
I mean, you're not fully using your entire body,
Right.
like super intensive, but your fingers, your focus, standing up, making sure the pad goes in the right spot.
Yeah.
I think it's amazing, man. It's truly amazing.
It takes time and dedication,
Yeah.
like any skill set.
Any skill set,
Any skill set. And I think probably what I would pass on to anyone, maybe my young self or anybody in that same position, is that you have to be patient with whatever skill set you is, and you have to strive for mastery. A lot of times I would think societally, we don't necessarily get pushed to mastery, right? We get to be complacent, or we get to be competent in a skill, and we say, okay, that's enough. All right, move on to the next. Okay, that's good enough. I'm not sure who the quote is from, but mastery is when you can't get it wrong, right? Mastery is when, you got it so that it's like the back of your hand, as opposed to, I got it the first time. So like, imagine me practicing, just like you showed us just now, right? You got one peg, you didn't give up, say, I'm going for two, until I keep getting it right. So mastery is saying, hey, I'm gonna go until I can't get it wrong. And so there were some comments about, me practicing this on one leg and doing other things to make it harder on myself. And some people were like, well, Doc, why are you making it hard on yourself? I'm making it hard on myself so that when I get into the game time, in the patient situation, right, things don't always go according to plan. But even if things do, I practiced for the hardest possible situations, so that when things are going smooth, it's just that much more efficient, right? And so the patient has a better outcome.
Well, that sounds like Kobe, right?
Yeah.
I mean, all these videos come out after Kobe's passing, God rest his soul, of how he practiced. I mean, he got beat up in practice and in one-on-one practice in the morning, and game time it's easier. I know I used to love practice. I mean, I still do, like playing ball for Philly or Minnesota, Seattle. I thought if I didn't get the proper practice reps or mental reps in practice, game always felt off a little bit. Game time come, I didn't see that coverage. I didn't see that man press. I didn't get a chance to feel what it feels like to run that post versus cover 2 or cover 3. And I almost sometimes want the defensive backs to know what I'm doing to make it harder, because game time comes around. Exactly. It's an easier catch, like, oh wow, I'm wide open now. So I think those who are listening could appreciate that. Yeah, definitely appreciate that.
Yeah, I'll say practice is very much a skill set. Practice and recovery is a skill set.
I agree. I agree.
Give me a time when, obviously, MRIs, imaging, X-ray, they do a good job of, you kind of know what you're getting into. But it's not 100% of the time. Like maybe they got their imaging and then they're like, all right, before surgery, I'm gonna go on a 3-mile jog, just whatever. Give me a time you got into surgery. Maybe a meniscus was hanging somewhere you didn't expect, or again, you tell us, but give us a time where you went into a surgery and when you got in there, it didn't quite look how you thought it would. What was it? How did you overcome that? And then how does that training that you guys have been talking about, how did that prepare you to kind of handle that situation as it came up?
Yeah, that's a great question. That happens not infrequently. You made an allusion to a situation like a patient goes and does something on top of an injury, and that's actually not uncommon. You'd be surprised. I would say the most unpredictable surgery is the ACL surgery. And it's not because of the ACL, it's because of the meniscus. The meniscus, you might remember, is that shock pad in between the knee. It frequently is injured with an ACL injury. MRIs don't always show us the extent of the injury to the meniscus. The ACL is more, for the most part, it tends to correlate, but the meniscus, an MRI is just a moment in time, whereas the meniscus is creating shock absorption in real time in between your knees. So it might look like, the meniscus just has a small little cut in it on the MRI, but you get in there and actually that cut goes all the way around the ring, and the meniscus is like flipped out of place. That's called a bucket handle tear when it's torn like that. Like a bucket handle like sits on top of the bucket.
Oh, gotcha.
And that can change the course of the surgery and even the recovery dramatically, right? So the name of the game is preparation, right? So preparation really helps to undercut those feelings of anxiety, and being over-prepared is how you make sure that you're ready for anything. And so the same principles apply here. Like, so we come in and I talk to the team before surgery. I'm like, hey, look, this is ACL. I think it should be standard. I have concern about this meniscus. Let's have everything ready, right? If I need to stitch this meniscus up extensively, you have the stitches ready. That's where that circulator nurse who's kind of helping get things.
Gotcha.
I've spoken to him or her and I said, hey, look, we don't need to necessarily have this, on the table right away, but have it nearby because it could go this way. So that preparation, that communication allows us to kind of overcome any real anxieties with the team and myself too. And so that's the most common thing where things are kind of different than what we planned. A standard ACL versus ACL plus a meniscus tear, a bad meniscus tear, that really changes the rehab for the patient. It can change the time of the surgery considerably too. It can add 30, 45 minutes. A bad one, I've seen an hour, like a really bad one. So it really can change the whole course of that. And then the patient cannot put weight on the leg as fast or as quickly as they would with a standard ACL. So everybody's situation has changed. communication with the patient is key beforehand too. So in most cases, I say, hey, look, this is what it looks like on the MRI. Sometimes we get inside and the MRI is not what what is the real situation.
Right.
So when we have our preoperative appointment, I'm breaking down every piece that it could be. I'm like, hey, look, if it's a standard ACL, it kind of looks like this. If it's kind of a small meniscus tear, because sometimes they heal themselves and we don't have to do anything, then it looks like this. If it's a big tear, a bucket handle tear, like I said, right, this might take a little longer to come back from.
Right.
And so I want to prepare you so that you feel informed for every possible scenario what this could be. And I think that's key to the patient, provider relationship, so that you feel like I'm the consultant. You feel like you're the driver,
right?
And I'm just giving you the options of what could happen.
What could happen?
And this is how we deal with each situation.
You know what's crazy? Just listening to you, like you're dealing with somebody else's life, literally, right? I mean, you put them to sleep and you're going inside their knee and shoulder and hips. I'm just listening to it because I know how big your practice has grown over the year, and how many names and faces you know, and then moving from one mode, and I think this is very important, moving from one mode to the next mode. You're going from paperwork to client facing to actual surgery, and how many different energies that is, right? It's like, it's different energies. It's like spending time with your wife, then you spend time with your kids. That's like two different energies, right? And so that's a skill set in itself, right? Because now it's like, all right, I've seen 50 patients this week, right? But I gotta know exactly what this guy needs.
That's exactly right.
And then knowing that I've got another 20 patients to see before I do surgery on him, then he shows up with the next surgery. So I have to it's amazing because now you have to put away all this distraction, all the noise. Boom. But not only do that, but I have to prep. I gotta prep to go in.
Right.
That's crazy, and that's amazing. And here's another thing I just want to bring emphasis to. Now you in there for almost 2 hours sometimes. With this little thing right here.
Moving
for
that
2 hours,
around,
man. How long did I last? 10 minutes, 5 minutes?
You were getting tired. Tired in the back, right?
It wasn't even my back. It was my mentals is like, bro, I can't pick this little peg up, man. So it's once again, it's hats off, because that's a lot of mental acumen, emotional intelligence that you gotta have through the phases of your day, and then definitely to the game part, the game day, actually doing the surgery.
Yes, sir.
That's wild.
Yeah, man.